Well, let's talk about all of this now with Dr. Layla McCay. She's director at the NHS Confederation. Joins us once more. Good morning, Layla.
Good morning.
Good morning. So we're told we're going to have these tests rolled out for secondary school age children across London from next week. 7 particular boroughs and most of the North East, also parts of Essex and Kent. Kent, of course, already in tier 3. A lot of people are angry about that still. And we're told that we could, at the next review on next Wednesday, see the whole of London move into tier 3 up from tier 2. That, of course, massive impact on hospitality jobs. We're going to talk about that later in the show. But do you know any details yet about how this testing will work? Because I've seen conflicting reports about the kind of test they're going to be using. Is it the PCR test or is it the lateral flow test? Different costs, different time frame for getting results back, and very different results we've seen.
I think we're still waiting to get the detail of that. Certainly the lateral flow test is something that is a bit easier to carry out. You get the results more rapidly. So that is one of the tests that is very much being looked at. But I think that we're all waiting to see what exactly is going to be the case. But what is important is that with the COVID cases rising in certain areas, there is a real concern that this is going to impact on children's school, and that's what we really want to avoid. And we also, of course, want to avoid, even if these children and young people get the virus, even if they don't become very ill themselves, they may then pass it on to others. So these are all challenges that need to be faced. So it's really interesting that they're going down this route of testing of these children.
Yeah, indeed. Well, of course, the argument is that mass testing is how you discover, how bad the problem is or how good the problem isn't, and also how you track and trace people and the like. But we also know that it's been justified as the way you get out of a higher tier. I mean, it's been claimed to be by numerous cabinet ministers that it was the result of mass testing that meant that we saw infections go down in Liverpool. Simply not the case. The data is very, very clear. Not my opinion. Objective government official data showing that the infection rates in Liverpool were going down 2 weeks, not even just a few days, 2 weeks before mass testing, and plummeting 2 weeks beforehand it started. There is a lot of concern that actually mass testing will actually lead to you find a load of cases of people who are not pre-symptomatic but just asymptomatic, people who are perfectly well themselves, people who aren't going to pass it on to older people. I don't know anyone right now who's meeting with older relatives, and that actually we kind of create the problem by identifying people who are perfectly well, who have the virus. It is the case, is it not, that we are not seeing any hike in hospitalisations in London. We are not seeing a hike in deaths at all in London. We saw pretty much no change before, during and after lockdown, which suggests that actually we don't have a wide-scale problem in London.
I mean, across the country, the amount of people going into hospital with COVID has nearly doubled in the last month. So it's not the case that everything is cruising along at a flat level here. We are actually seeing increases in certain areas. And what we need to do is nip that in the bud, really. What we have is the vaccine has started, but we know it's going to take months before everybody who needs it has had the vaccine, just because of the scale of that programme. So what would be really frustrating is if we lost control of the reducing cases and we had another hike in those cases. That would be bad for everyone. Yep. So really what we're looking at here is we have a toolbox. There are various things within that toolbox. One thing's mass testing, one is test and trace, one is social distancing, one is the vaccine. And we need to be using all of these.
Yeah. Although, again, you talk about, with these figures, the number of people going into hospital, COVID has doubled in the last month, bearing in mind that, at least 16%, in some places up to 34% of people who have COVID in hospital are people who've caught it while they've been in hospital. We see massive increases in the number of people who go into hospital with respiratory diseases every autumn, every winter. December is when we would start seeing it. And that the number of people currently in ICU beds and in hospital is not above the normal percentages that we would see in any other year. Is it? We're not above capacity.
At the moment, we're working really hard to maintain capacity. We still are seeing that in some parts of the country, things like elective care have to be postponed. And that is a signal that what we have here is concern that there's not going to be enough beds to allow that elective care to go forward. And COVID-19 is certainly playing a really significant role in that. So it's not just that we need to have enough beds with COVID-19, we need to have enough beds to make sure that everyone who needs care is able to get it.
But there is no part of the country where COVID patients take up more than 16% of the beds in NHS hospitals, is there?
But there are parts of the country where in one hospital, several wards are given exclusively over to COVID-19 patients. That is going to have a knock-on effect on everything else.
But again, these will be parts of the country that were not hit last time round, and unfortunately experiencing, to all intents and purposes, their proper first wave. Very tragic, very sad. And again, we wish we'd had the vaccine sooner for that. But again, this is about people being careful, social distancing, not meeting, not coming into contact wherever possible with people who are vulnerable, either under 70 or particularly over 70s. That's going to be the absolute key. Just finally, just briefly, would you, if you were in charge, let's put Layla McCay in charge in number 10, would you be having those 5 days off for Christmas?
At the end of the day, it's a really difficult call to make, because we know that when people get close together, when they get inside together and different households are mixing, that certainly does increase the risk. And I would certainly hope that if that was a decision made, everyone would really focus on trying to do that in the safest way, with their windows open, with their social distancing, with making good decisions about who they choose to see during that time.